Well, this is my follow-up video. Last video I made was a week ago tomorrow, Wednesday, when I went to the ENT and got my results for the biopsy and found it had cancer. So after that, there's been a few appointments that I've gone to and have made. Now, again, hopefully this video is helping people who may be going through this as well to kind of understand what to expect and kind of what that process is. So after I got the biopsy, the next step was to meet with a medical oncologist, which I did. Very nice doctor, good bedside manner, explained kind of what my options might be depending upon what the results of the PET scan coming up next week will be. And so, fingers crossed, if the PET scan shows that it's, kind of isolated, then, my options might be radiation, or even potentially surgical intervention. So he kind of discussed how those things work. He made a referral for me to visit a radiation oncologist, and he gave me the name of a very good surgeon in Orlando that does this type of surgery, assuming that potentially I'm a candidate for that. So I had my appointment. So I left there. That was on a Friday, and then on Monday I met with the radiation oncologist, and that was a train wreck. That was actually yesterday, and I will say so far yesterday was, by far the very worst day I've had since this process started. That doctor was horrific. It came into the room. He was all disheveled, dressed like crap, and zero bedside manner at all. He literally acted like he was on the clock, that this was a job that he had to be there for 8 hours to do. He just didn't give any sense that he gave a damn about his outcomes. When I asked him, about the process, he explained just how horrific the treatment was going to be if I chose radiation. He literally, and I get it, they're supposed to tell you what the potential downsides are, but you should do so in a way that explains, I guess the cost benefit part of that whole discussion. He just painted the most miserable picture you could imagine. And then when I had told him that I was also considering surgery, of course, that was even worse in his mind, that if I had surgery, it would be the death of me, basically. So I walked out of there thinking, what the hell am I supposed to do now? I didn't like the way he acted. I didn't like the way his staff acted, quite frankly. They were all like robots. The place was dirty. And I literally left there thinking, man, this is potentially going to be where I'm putting my life in the hands of these people. So like I said, it was a really bad day, and I told my wife so, that it was, I was trying to be strong through this whole thing, but that one really rocked me. So I did some thinking about it. And this morning I got up and I made a quick drive to a town nearby where there is a pretty good radiation oncology center through the Advent health system, which did my prostate surgery many years ago. And they're well funded. They have good good doctors. So anyway, I just went just to see what the place looked like, and it was fantastic. The staff were very friendly. And so to make a short story long, I ended up firing my current radiation oncologist and hiring them. And so I have an appointment with them coming up here in a couple weeks, right after I get my PET scan, a few days after I get my PET scan. And the downside is that you weigh these decisions because you think, well, I'm delaying treatment potentially, but I think at the end of the day you have to analyze, are you going to be comfortable with the treatment decision at one location, or is it worth delaying things a week or two, and going through treatment with somebody that you're a lot more comfortable with. And I can say hands down, I'm happy that I made that decision. The other good news is that I was able to secure an appointment with a otolaryngologist, or whatever they're called. They basically do surgeries of the head and neck. And the person that I was able to get an appointment with is in Celebration, Florida, about a little over an hour away from here. But he literally wrote a book on robotic surgery and he of the head and neck, and travels the country teaching people some of the skills that he has acquired over the years. A very well-known doctor, and I was able to get an appointment with him. So if I choose to go the surgical option, I would feel very comfortable in his skill set as well. So we'll see. Like I said, today is the 29th of April. I have my PET scan on the 8th of May, and then I have both a radiation oncologist consultation with the new doctor on the 13th of May, and then in that afternoon I have the surgical consult with this doctor in Celebration on that same day. So we'll see. My throat has been sore, and I get hoarse real easy. I don't know if it's related to this, or if it's still kind of left over from the bronchoscopy and the biopsies and all this shit that went down my throat. But I've had a headache, and I've had this little bit of a sore throat, but dealing with it, So anyway, like I said, the purpose of doing this is, number one, to help me keep my sanity about what it is I'm doing here on this journey. But it's also maybe to give back a little bit in terms of helping somebody else. I've watched a couple videos of other people, and I found that it's helped me kind of be prepared. And so that's all this is to help you be prepared if you end up going through the same thing, right? It's nice to kind of go through it with somebody else that you don't even know, I guess, but they can tell you a little bit about what to expect. So I think that's it for today's update. I will keep you posted, and once again, I appreciate the opportunity to do this, but more so I appreciate those of you who are going through this and chose to watch these videos that might help you do it. So anyway, have a good day.